although it doesn't seem to be as much of an issue now, even still to this day, a person who is not vaccinated is significantly more likely to be hospitalized or die from COVID, about a six-fold increase. Hey everybody, it's Dr. David. So, with all that is going on with Omicron BA.4/5 right now, especially BA.5, I thought it would be interesting to take a look at how many advances that we have made over the last couple of years. And I thought it would be interesting to compare and contrast the situation when President Trump had COVID back in 2020 compared to how Joe Biden is doing now and what his circumstances were. And I think it makes for a nice little conversation here. So, we know that there's 21-month period in between. We certainly know a lot more about the disease, much more effective treatments, prevention strategies, etc. And that's within mainstream medicine. We're not even talking about what we've learned in our holistic world in terms of other treatments and approaches that we're taking. But I'm going to really be focusing today on the mainstream world, since that seems as if that's more of where the good comparison does make. From my understanding, I believe that part of President Trump's regimen did include zinc, and I did not hear any mention of that relative to President Biden. But that's really from an alternative perspective, the main thing that I've heard differently from there. So, first of all, let's talk a little bit about protection, because, well, even before that, one of the things that we know is that it certainly does seem as if President Trump had a much more difficult situation when it came to his COVID. And we'll go into that a lot more, but we know that he was hospitalized. We know that he was put on oxygen. From what we've heard, there was discussion of whether more intervention than even that was needed in terms of respiratory support. But thankfully, he did fine after he was after he went through treatments, which we'll talk more about. And we also know that President Biden seems to have a very mild case of COVID. And thankfully, both men seem to have come out of this okay, and that's obviously the most important thing overall. Okay, now, so what do we first talk about? Prevention. Now, back when President Trump had the virus, there was no vaccine available. We know that he was an early advocate for the vaccine. He was certainly pushing forward. Part of Operation Warp Speed. We know that his position seemed to take a turn after that, in terms of not nearly being the advocate for vaccines at the time. But we know that it wasn't something that was available for him anyway. So I guess from that perspective, it was a moot point. Of course, on the opposite side, we know that President Biden has been for a very long time an advocate for the vaccines, and we know that he did receive his two primary vaccines as well as two booster shots. So, certainly going into the infection, President Biden did have much more there in terms of circulating antibodies. And, that's what one would expect if you've had four previous exposures. Now, treatments. Now, currently, there are three antiviral treatments that are available in the United States for outpatient. Pardon me, there two. One is Paxlovid, and then and as well as an oral medication that's called and I'm gonna have to pronounce this, Manupravir. I may have said that wrong. Those were the two that came out, but we did also find that the Pfizer version, which is the Paxlovid, actually, I think that was Merck. Come to think of it, the Merck version, which is Paxlovid, maybe it's Paxlovid. Sorry, I'm sorry, I may be wrong on the manufacturer, but it's Paxlovid, so we're just going to go with that. Um, but the is a much more effective treatment, and that's why you're really only hearing about Paxlovid at this point. There were IV interventions that were available, such as the intravenous remdesivir and monoclonal antibodies, etc. When President Trump had contracted it. Now, um, right now, there is only one monoclonal antibody that is potentially available and successful for the BA.4, BA.5, which again, another one I'm going to have a difficulty pronouncing, so I'm going to look this one up right here. So it's bebtelovimab. All these monoclonal antibodies, they end in MAB for monoclonal antibodies, and so they're MABs. So whenever you hear a MAB, that means that it's a monoclonal antibody of some sort. But the Regeneron versions, they don't work. The other versions that have come out since then didn't work. So we're much more limited in terms of the availability as well as the products that actually seem to work when it comes to that. Now, President Trump, he got the Regeneron monoclonal antibody. He got the remdesivir, which is the intravenous antiviral, because there wasn't anything oral available back then. And the remdesivir was really only being given in hospital situations. Whereas we know that President Biden, as soon as he tested positive, that the Paxlovid oral outpatient version antiviral, that's what was given to him. Now, another thing that was obviously quite different are the variants. So back when President Trump had it, he had the original strain, which we felt, and does seem to be still confirmed, was a much more dangerous, much more severe disease, much more what we call virulent, much more likely going into the lungs, and that is probably the reason why he did need oxygen and that type of hospitalization support, because back then things were much more going into the lungs in the first place. We know that Omicron doesn't go into the lungs, although it does seem as if BA.5 may be picking up some of those Delta versions that were going into the lungs, but certainly not the same impact as the original version that President Trump was exposed to. Now, of course, with President Biden, it's been confirmed he does have the BA.5 Omicron um, subvariant, which we know is by far and away the most contagious version that we've seen yet. But we also know it's not as dangerous, not as much going into the lungs as some of those other ones. So that's kind of one of the different contrastings there. So it does seem as if with President Biden again, he just got off with an easier version. Okay. Now, another thing, of course, whenever we're talking about how severe, how much intervention, how much observation we need to be taking, has to do with a person's risk factors. Now, both of these gentlemen, when they caught the virus, they were in their 70s. Donald Trump was 74 at the time. President Biden was 79 at the time of his contagion. So those alone are obviously clear risk factors. Now, there is some other differences in terms of risk factors. We know that President Trump, he's obese. Okay, we know he does not exercise. We know that his dietary choices are lacking, to say the least, in terms of his love for fast food. Whereas, from what we've heard, President Biden, he certainly looks much more in shape. He certainly looks, he could tell from his observations that he is not obese. We know that he exercises on a regular basis. We know that he bike rides. We know he had his little fall when he tried to stop the other day, or last month, what it was. But we know he did fine with that. But he is much more of an avid exerciser. And of course, from a risk assessment perspective, we know that President Trump, as I said, was not vaccinated, whereas President Biden was, and we know that that is a risk factor, is being not vaccinated. Although it doesn't seem to be as much of an issue now, even still to this day, a person who is not vaccinated is significantly more likely to be hospitalized or die from COVID, about a six-fold increase. The numbers were much higher back with when President Trump had his version of it, but still, nonetheless, it is still a risk factor when a person is not vaccinated versus when a person is. Now, of course, the severity, which I touched on a little bit, from everything that we're hearing, President Biden had very mild symptoms, very mild flu-like symptoms, some fever, some chills, some aches, some sore throat, some congestion, and some cough. Typical flu-like illness. What, of course, we know that President Trump, as I've said, was hospitalized. He did have low oxygen levels. He did require oxygenation. He did require intravenous um, treatment, and he did require being overnight in the hospital. I believe it was for 3 nights, if I'm not mistaken. But as I said, thankfully, both presidents did well in the long run. Obviously, we don't know if there will be any long COVID symptoms with President Biden. We know that some people have mild disease and can develop it. We haven't heard about any situation as far as President Trump with his in terms of long COVID. Although we certainly didn't get the same level of transparency when it came to President Trump's illnesses and health overall compared to what we're getting apparently from President Biden. But again, the most important thing is that it does seem as if both men are fine, and that's the most important thing. So, anyways, I thought that was kind of an interesting comparison, points to have there, because again, it kind of gives us another way of looking at it, whether us or our family members were to catch COVID now, and knowing what all of those risk factors are, as well as what the different treatment options are, certainly can help us dictate what decisions we're going to make going forward. Hope that helped. Now, of course, if you haven't, please subscribe to this YouTube channel and hit and join us on our other social media platforms. Have a great day.